Hello everyone, this is Medical Gateway, and in this part we are going to study regarding the inflammation. So what exactly inflammation is? Inflammation is a biological response of body tissues to harmful stimuli. So whenever there is a harmful stimuli in the form of bacteria or virus or some other pathogen or some irritants, the body is going to give some response. The body is going to give some protective response, and this protective response will involve the immune cells, the blood vessels, and many chemical mediators. And the main purpose of this inflammation is to eliminate the initial cause of injury. So it's pretty simple that some harmful stimuli is there. Now body wants to protect the body from this harmful stimuli. So how exactly the body is protected? So by the process of inflammation, basically we want a lot of immune cells, the white blood cells, there at the point of harmful stimuli. So basically the chemical mediators are released, which will cause vasodilation of blood vessels and increased permeability of blood vessels, which will help a lot of WBCs to move to that area of inflammation, the area of injury, and that will make easy for the WBCs to move out of the blood vessels into the tissue where there's harmful stimuli, and those WBCs will protect the body by eliminating the initial cause of injury. So this is the inflammation. So let's discuss it in a little bit of detail. So inflammation, the main starting point is injury because of anything. So because of this injury, the injured tissue will release some substances, will release some inflammatory mediators, will release some chemicals which are basically going to cause inflammation. So these chemicals are the histamine, bradykinin, prostaglandins, serotonin. So histamine, bradykinin, prostaglandin, serotonin, these are the chemicals which are always related to inflammation. Then we have lymphokines, complement reaction products, and the products related with the blood clotting. Okay, so what all of these chemicals are going to cause? All of these chemicals are basically going to cause vasodilation and increased permeability. So now the blood vessels are dilated. Why we need vasodilation in this case? Basically, we want a lot of blood to flow to the area of injury. And why we want a lot of blood to flow into the area of injury? We want a lot of WBCs to come with that increased quantity of blood. So that's why there is vasodilation. And the second one is increased permeability. We want these WBCs to easily move out of the blood vessels to the area of injury. So there is vasodilation, there is increased permeability, there is a lot of WBC migration with that blood. So when a lot of blood is coming to the area of injury, then there will be swelling of tissues at that point. Okay, now so these WBCs are going to fight that foreign invader and going to kill it, okay, or going to manage it one way or the other. Okay, so and the final point is there is also clotting of fluid in the interstitial spaces. Now there is a point of injury, there is increased amount of blood flowing there is increased number of WBCs there, and that is the area of the inflammation. So we want that inflammation to be just at the point of injury. We don't want it to spread. So there is clotting of fluid in the interstitial spaces to cordon that area off. Okay, so this is it. This was inflammation. And with reference to the signs and the symptoms, the area of the inflammation is red, it is swollen, it is painful, it is tender. So at times, inflammation, the clinical scenario of the inflammation comes just like this, that the patient comes and he has swelling, pain, tenderness, redness of skin at some point where there is injury or there is infection. So that is basically inflammation. Okay, so physiologically speaking, it is just simply that there is injury and the injured tissue is releasing inflammatory mediators, these chemicals, and which are basically causing vasodilation and increased permeability for a lot of WBCs to move there and fight with that foreign invader. Okay, so this is inflammation. See you in next part.